Good evening, everybody, and thank you for being here. I am Gauri Vagnar, and it's a pleasure to introduce Dr. Subroto Das. Subroto and I have been working together since 20 years now? Something like that. And thank you. So I can refer to this, but I can also just talk about Subroto like that. Having met with an accident, uh, he started Lifeline Foundation with Sushmita, and oh, here it is. It was founded just after the earthquake around that time. And my role at the time was also very different. And because of that, we connected and we have been connected ever since. Eventually, I became also a member of Lifeline Foundation. And for the last 20 odd years, we've been doing something or the other on safety. Yeah. Whether it's on emergency services, whether it's road accidents and road safety, industrial safety, all of that comes under the kind of work that we have been doing individually and together. So Subroto is now a Padma Shri Awardee, which is a great honor to be recognized by the country, and also a great honor for people like me to be associated with him. So he's an Eisenhower Fellow, part of Niti Aayog, lots of things. But the most important thing to know is he's very grounded, down to earth, approachable, and is always looking for solutions that can be brought to public at large, right? For safety. Shall we start? Yeah.
Thank you. Thank you for those very kind words. As she said, we've known each other for 22 years, in fact. And frankly speaking, it would be better if she talked on road safety than me, because she's been into road safety before we had this crash and came into it. So what Gauri doesn't know about road safety is perhaps... so if what Gauri doesn't know about road safety is perhaps not worth knowing. It's my honor to be introduced by her. At the same time, the pressure increases when you have somebody like Gauri moderating for you. But that's how Gauri is, and I'm sure she's going to be very incisive when I talk. Surprisingly enough, Ahmedabad has the highest number of accidents in the country as a city, including the five big metros. But it still worries me and concerns me. Why are we not road safety sensitized? It's been nearly 20 years and I still feel we could do a lot on road safety in Ahmedabad. We come from Baroda though, but Baroda is equally bad, but Ahmedabad, given the statistics, should do much more. Gauri has led it for some time. I suppose she's eager to do something more. Having said that, Lifeline Foundation that Sushmita and I co-founded is perhaps the only non-profit working in the cross sectors of emergency medical services, something that you know as 108, the occupational health, industrial safety, trauma care, and road safety. We started off with road safety, but we've realized trauma accidents happen everywhere. So this is a story of BBC, that one of the first stories that were written about us. So Sushmita and I met with this accident in Vasa. If you're familiar with Vasa, the 21 kilometers north of Baroda, that's where we stay. And we had this bad accident, 18th August 99, at 1:30 at night, and literally left to die because cell phones had just come in, 16 rupees an incoming, if you remember. Mr. Bajpayee, the then Prime Minister, was just starting to build the Golden Quadrilateral, so highways were two-lane and nobody would stop at night thinking somebody's faking an accident to loot. 4.5 hours it took. Finally, a milkman traveling to Amul with cans of milk early morning saw us, tried to help us, and he tried to stop vehicles, and when he could not, he put his bike across the road so the next state transport bus could stop. Brave of him, because his vehicle could have been damaged, and that was a source of livelihood for him to take the milk to the dairy, and he saved us. And if you ask me, that's the only regret we have on this journey, Sushmita and I, that we did not at that moment take that milkman's number or name.
The same goes for me.
I understand, yeah.
By police, and I was not in the mental state to take that.
Yeah. Unfortunately, that's the last thing that comes to mind. You want to do that. So that's the one regret that we have. Otherwise, it's been a nice up and down journey, but it's been great. So following that accident, Sushmita was very adamant that India needs a helpline. How can India not have a helpline? एक sort of उर्दू में कहवा है ना जुनून. There was this junoon that India needs a helpline. It spent 2.5 years working on a plausible solution. Finally, had to somehow reach out to the Prime Minister. He's the de facto head of the country, and he was building the Golden Quadrilateral. And we realized if he doesn't want to do anything about it, nobody will. And thankfully, we got the permission. And the only permission, according to him, that we needed, and which is so true about the country, is to put up signages. The one that you see there, because that's NHI roads, that's NHI land. You can't go and put up signages on NHI land. What was told to us in that meeting was very admirable, that nothing in the country can stop us from saving an accident victim. I'm talking of years back, 20 years back, it still holds true. So we had a GI, we did not have GPS then, cell phones were, as I said, non-existent nearly. So how do you find a person who's calling from where? You could be standing at a dhaba and calling up, and how do you identify without GPS? So what we did is we did a GIS. Sushmita and I used to get out every Sunday in a Maruti Esteem car that we had years back and walk the highway. I used to drive, or she used to drive, and the other person walk. And we had this road meter. I know you've all played with something like a road meter. You know, you have a stick and a circle and you run around with it. That is a road meter that gives you 100 meters accuracy. So we went on mapping and picked up every landmark on that highway between Surat and Ahmedabad. We stay in Baroda, so we wanted to do the pilot there, nearly center. And we marked everything possible. A railway culvert, a overbridge, an underbridge, a dhaba. Milestones, if you call them milestones. In Madhya Pradesh, they use a very nice word. Some people also take away milestones, and God knows they make a mandir out of it, and it's called Mileshwar. So we came across it in Madhya Pradesh, a lot of places. But having said that, we mapped everything. So you just needed to travel from here to Surat and say, fine, I've just crossed this Ram Bharosa Dhaba, and we knew where the accident happened, to the nearest 100 meters. Rally the nearest ambulance, crane, metal spreaders, whatever is required, fire engines, pick the victim up and take them to the nearest hospital, absolutely free of cost, no wallet biopsy. Took it to 5 states, and then Mr. Ramalinga Raju of Satyam, I always repeat this statement that history will judge him differently for what went wrong in Satyam, but it was his initiative to put a CSR in place, and that's how the 108 came in. That table there, that is where the 108 was ideated. That's Mr. Raju sitting with me on the table. That's her son on the right side, and Sushmita there. And though Satyam's gone out of his hands, he still works on other solutions on healthcare. We've been studied at Harvard, at Boston, at the Tata Institute of Social Sciences. We've worked in Sri Lanka. Courtesy a friend of Gauri, who was introduced to us by Gauri, and that's the person shaking the hand of the then president of Sri Lanka. And I wrote a book on the struggles of Sri Lanka post the tsunami. We even got, if you follow cricket, Sri Lanka's living legend, Muthaiya Muralitharan. He was a brand ambassador. The sorry part of it is we still don't have a brand ambassador for road safety in India. Mr. Gadkari, though, does come on personally to lead from the front, but it really, I mean, we need a brand ambassador. It doesn't happen. These are the footprints across the country. So at some point of time, we realized that we have done enough. We had talked to government. As a non-profit, your apex thing that you need to do is sensitize government and get policies done. And if you travel the highway, next time do observe that every toll plaza now has an ambulance. Every toll plaza now has a crane. So that's what we convinced government, and the government, NHI has put it on the main roads. So every 50-60 kilometers you would have an ambulance. So then it didn't make sense for us, having initialized policy changes and other things and infrastructure. We realized what you need is, when we did audits of ambulances and cranes and rescue people, we realized they're absolutely incompetent to help. The gap between a very good ambulance that NHI mandates and the people handling it was huge. The manpower competency did not match. So that's where we realized, let's start upskilling. That led to bystander upskilling and a lot of others. And that's how we are across the country training people. So 28,000 accidents handled in industries, ports, highways, airstrips, oil rigs and mines. That's the experience we bring in. We're the only organization perhaps with this multiple recognitions in Gujarat, in Rajasthan, in by the DG Mine Safety to train in mines, and we are also an international training center of the American Heart Association. This is a training record spread across various things that we do. Community first aid being one of the simplest things, but we also train Ayush doctors, we train doctors in industrial burns, we work on home health aid along with AMA. We created courses for home health workers who could go and provide care at home. We do a lot of things, and the different modules that we have done in India. We work with a lot of law enforcement agencies, but the third point is of very good interest. We are the only ones training GST officials, the guys who handle narcotics division of GST, in first aid and trauma care. Why law enforcement agencies need to be trained in first aid? Not because they will only go to save an accident victim, but they are at the receiving end many, many times. They get stoning and knifing and everything, so they need to be trained, and we have had pretty good success. We have trained forest rangers in Jasor. Ravi and I went on trained, and we realized forest rangers need to be trained also. They have a lot of emergencies that they face, and puts them up against animals and insect bites and a lot of other dangers. With Ayush, this is something that we did a very big innovation in the country. We're training Ayush doctors, Ayurveda, Homeopathy, Unani, Siddha doctors in primary trauma care, because Ayush doctors form the backbone of India's health services. You all need to understand and appreciate them, because if it was not for Ayush doctors working in rural areas, in small towns, and even on the general wards and floors of big hospitals, India's death toll in COVID would have been huge. They saved the country, and we need to be grateful to them. So we thought of training them in primary trauma care with the Ministry of Ayush's recognized training modules. We're trying to build ecosystems around toll plazas, which means just not training toll plaza attendants, but the villages around that place, the dhabas around that, the petrol pumps, the 108 facilities, the hospitals, in chemical spillage incidents. Nobody and none in the country ever thought of training toll plaza guys or highway stakeholders in chemical spillages. A lot of them happen. Today when we are coming from Baroda, we saw a huge accident. The expressway nearly stuck for 1 hour because a trailer with solar panels and a tanker had an accident. This is something that we did for Baroda city, and we continue to do it, and we wish somebody in Ahmedabad does it. We're trying to make Vadodara a CPR city, trying to train 40% of its able-bodied adult population, literate adult population, in CPR. Vadodara Municipal Corporation, as I was talking to somebody today in the government, is the only municipal corporation in the country where each and every person has been trained in first aid and CPR. And that's an initiative that we are trying to take it forward to other cities. So let's understand why road safety is important. 11% of global road traffic deaths happen in India. That's a huge thing. And this is 22 statistics. Our road traffic accident statistics are a bit delayed because India's data collection system is a huge challenge. The fatalities in India is now 1,68,000. And it's exponentially increasing, I would say. 3% of India's GDP goes in annually into road crashes, which means just not lives lost, but sources of income, disabilities, road damage, vehicle damage, traffic congestions, everything piles up. But what is more important for me is this last figure. There was a time when you go back and read, you will realize India's vulnerable population, the people who are dying, were 15 to 45 age group. If you go back and research. Today it is 5 to 29. That's the age group where we're losing. Extremely productive age group we're losing to accidents. That is the worrisome part. If you look at the statistics, we just talk about highways. Usually when we think, we just talk about highways. 5% of India's total roads are national and state highways. Just 5%. They account for 55% of the accidents and 63% of the deaths. There are lots of deaths happening on the other roads, in city roads, in urban roads, in rural areas, which we tend to ignore when we talk about road safety. It's something like we blind ourselves and we just think highways pe accident hota hai. Obviously, all of us know it. It's a statistics that you cannot ignore. 55.9% of India's road accidents are due to overspeeding. And that's a challenge that we have taken upon ourselves now. Gauri, you should be part of it. How many people of you, all of you perhaps have cars and bikes, all mobile. What is the speed limit that you think India has, the highest speed limit? Highest on any road. 100 is your highest, okay? What is bike that is produced and marketed, what speed does it reach? Or a car? Why would you have, if your speed limit nationally is 100, why would you have cars at that speed? That's where road rage comes in. That's a battle that we have taken up to somehow do it. We don't want to get into activism. Collector के office के सामने धरना नहीं देना है, but we're trying to sensitize that at some point of time, if the government has given a limit of 100, why have vehicles going that way? And that is what leads to road rage. Dangerous, reckless driving, overtaking is the second biggest cause, and there are other causes too. 58% of India's road users are vulnerable road users, which means they don't have a protection around them. When you're in a car, you have a shell around you. But pedestrians, two-wheeler, three-wheeler, cyclists don't have something to protect them. And 58% of India's deaths happen to these people. That's a huge amount. And we have nothing infrastructure-wise to prevent this, nor road safety. This is a very skewed, no gender bias here, but 29% of the fatalities are women, 71% are men. You have to remember, men are more on the roads than women are. Conversely, and Sushmita always reminds me of this, women are more safety conscious and health conscious than men. So that's a huge factor. And that is why perhaps accidents are lesser for women than men. Road safety variation across India. There's a nice document, Indian Status Report on Road Safety 2024, a Government of India document, which you can, IIT Delhi, TRIP, did that. Tamil Nadu, Telangana and Chhattisgarh surprisingly have a fatality rate higher than Chhattisgarh. You would be surprised. Not urbanized, but that is where the point is. Not all accidents happen on highways, rural roads. West Bengal and Bihar have the lowest fatality. 6 states account for half of India's road fatality, just 6 of them. Thankfully, Gujarat is not one of them. Only 7 states have we seen 50% compliance on helmets. I don't know how many of you have gone to Guwahati. Take a trip to Guwahati and you'll realize that. The Chief Secretary of Assam government challenged us कि आपको एक भी इंसान दिख गया, we were there for 3 days, एक भी इंसान दिख गया अगर हेलमेट बिना on a two-wheeler, या पिलियन भी दिख गया, come back to me. And whatever you want in Assam, we'll do it for you. Believe me, 3 days, the first trip to Guwahati, 3 days, we did not find a single person non-compliant with helmets, not even a pillion. It's a case study. I mean, in fact, I'll talk to you about that later, but it's a case study that needs to be followed everywhere. Our highways are nearly not audited. 8 states have only more than half of their national highways audited. State highways ka to pata bhi nahi hai. This is something that's very important for you as individually to understand. A trimodal peak of death. When accidents happen, road traffic accidents happen, there's something called a trimodal peak of death. This goes back 1960s, research done, Turnkey and et al. And they said 50% of the deaths happen immediately on the spot or within 5-10 minutes. Severe crash, a tire has gone over my chest, there's no way I'm going to survive. I've got a huge skull fracture, I won't survive. A main artery is cut off, there's no way I'm going to survive. 50% die on the spot. It's the rest of the 50% that individually us and collectively we can save. And that's what the SDGs is about, which I'll come about. The next 30% die within 48 hours. Acute blood loss and ruptured spleen, ruptured liver, they could be saved if we had provided them transportation first. More importantly, care at site. That is important. The rest 20% die within a week. Infection has set in, a huge blood loss has happened, there's no way you can. But this 50% is what we should target at least to save. And these are in our hands. I would request all of you perhaps to take a snapshot of this. You'll find it on the net. Or if you remember it, Emergency Care System Framework. As an individual, this perhaps is your best guide to post-accident management. Just not roads, any emergency. This is available on the net. I always tell people to take a snapshot of this so that you can go back and refer it. The system approach, there's nothing better than a systems approach on this, and it's a real nice guideline. It's not clinical, so it's not that you'll not understand, but it'll tell you what to do. The laws of the country are quite pro-citizens in case of accidents. The Motor Vehicles Act 1988, please understand, the central government issues the Motor Vehicles Act. It's been legislated in 89 by the parliament, but it's for the states to enforce it. So the road safety falls under the jurisdiction of states, not the central government, though the central government makes laws. There, in 1989, the government promulgated the Central Motor Vehicles Act, which is the guiding act. There have been amendments, and there have been road regulations. So this is your guiding act as far as road safety is concerned. Registration of vehicles, driving licenses, everything. You have a question, go to this. Most of your answers will be there as far as vehicle registration, driving licenses, and everything is concerned. In addition, the Indian Penal Code helps erring drivers when they hit pedestrians and others. The National Road Safety Council comes up with guidelines. The municipal corporation has their own acts, how to use footpaths and footbridges and others. And there's a Road Transport and Safety Bill of 2015. It's a draft bill, still not gone through in Parliament. It's been 10 years. Government of India and state governments have a lot of road safety measures. Infrastructure improvement is one of them. National database for fatal crashes is another. The ministry keeps its own database. The National Crime Records Bureau, NCRB, also has its own records. But is this the two topics in the block? Enforcement, education, training applies just not to government but to all of us. Public awareness campaigns, speed limits, traffic signals and signs, seat belts, helmets. Government has laws, but it's for us to enforce it on ourselves and to others. We fail to do that. So government may go on creating laws. I always say India is a country of a lot of rules and regulations and sometimes zero governance, because we ourselves as citizens don't enforce it. We expect government to enforce everything. There's Article 21 and 47 of the Indian Constitution that gives you a right to life, which is important because that's where the state comes in to save lives. There's been a judicial intervention. You might have heard of it. Parmanand Katara, a senior advocate of the Supreme Court, came across this case where a scooterist who had an accident, he took him to one hospital to another in Delhi, and all of them refused it. By the time he got admitted, the patient died. Being a senior advocate of the Supreme Court, he filed a PIL, and it's called the Padma Katara versus Union of India. And it's the first judicial intervention that came in where the Supreme Court instructed no hospital can refuse an accident victim. No hospital can, not even a government hospital, not even a railway hospital, nobody can refuse an accident victim. They'll have to do it. Yes, if the surgeon does not, if there's no surgeon, he can't operate. But basic life saving procedures and protocols will have to be followed to give the person time. The Good Samaritan guidelines passed out again by the Supreme Court. A friend of ours, Piyush Tiwari, you can Google him, Save Life Foundation in Delhi, filed a PIL saying Good Samaritan should be protected. So in this, how many, any doctor here? Okay. So in this entire room, if there's a road crash and all of us go to help and something goes wrong, I'll be the only one criminally liable because I have a degree to practice. All of you are trying to save that victim because in good faith. When you try to do something in good faith, you're not punishable by law, which empowers all of you to go out and save a road traffic accident victim, not an industrial accident victim. You can't trespass into somebody's industry. But on the roads, you can always do that. So that's an important tool you have. There's a National Ambulance Code, which specifies how ambulances should be, and not this, there's this photograph on that side, extreme side, is my favorite photograph of an ambulance. So when Sushmita and I were working and started all this work, we came across this guy. And we saw this ambulance, Matador, a Matador van. If you remember the Matador vans, yeah. So there's an upholstery, there's a settee, there are curtains. So we asked him, Abadu kem? His response was, Sir, હું 5 દિવસ એમ્બ્યુલન્સ ચલાવું છું અને શનિવાર રવિવાર સ્કૂલમાં પિકનિક માટે આપું છું. So that's why the upholstery and the sofa. That's what our ambulances were. A lot of things have changed and you have good ambulances now, mandated by government. 1033 is a number that Mr. Gadkari assigned it for the highways. So all national highways now have 1033. And it's a great initiative, believe me. The Supreme Court Committee on Road Safety. So there's a district road safety committees. I don't know how many of you know that Ahmedabad district would have a road safety committee under the collector. And you can always reach out and be part of it, be invited to the proceedings. I'm sure if you go and meet the collector and you're interested in it, there could be a guest invitee for you to understand what's happening. Every district has it. But why are we still failing? So if you look at it, 2020 we were supposed to halve our deaths in accidents. If you look at 2015, we were at 11.81. 11.81. If you look at 2022, there's the last statistics that have come out, it's 12.4 death rate. It's increased, it should have halved. Yes, there are years of 2020 when it was less, but that is a COVID year, remember. We were not on the roads, so that's why the numbers are less. So we have miserably failed on this. There is a yet to be published study which says that 90% of the times, and please understand, 90% of the times when a patient is brought dead to a hospital, you come across times when the doctor says he's dead when you take the patient to a hospital. So 90% of the times when this happens, the patient is already dead at the time of being loaded into an ambulance. Because in good faith we call an ambulance, we call 108, but because we are not trained at bystanders, we don't do anything. Its ignorance is scary. That is what drives us. अगर गलत कुछ कर लिया तो because we are not trained. And that's where Gauri, me, Sushmita, Ruchita here, Ravi, we all try to tell people that please get trained in first aid. And first aid is not necessarily on the road. There's enough evidence to back it up that more emergencies happen at home than in offices and roads. A child choking on something, swallowing, an elderly person falling in the washroom, breaking a hip bone, kitchen burns and cuts, bee stings all happen at homes. It don't happen at in the gardens. It doesn't happen in offices and roads. So there are more emergencies happening. It's always better to get trained in first aid. Why are we failing? This is a very nice book to read, an article to read, The Silozation of Humanity. We have started to live our life in silos. You know what silos are? You store grains. That is just what a silo is. Our every action, our daily life is in silos. And that is what is killing, because road safety has 4 components. And engineering, which is beyond all of us because that's engineering of the roads, government centric. Enforcement, which is police. Education and emergency care. The 4 of them are working in silos. They're not working together. And that's why we are failing. I'll just give you an example. Road safety education. One of the 4 E's, the third E. How does it work? So the police will teach you on road safety. They'll come to school and teach you on traffic rules. But they will not tell you how to call 108, which should go naturally. Abroad it happens. The fire brigade goes to teach students and kids about how to deal with road safety. They would teach you how to access 911. But in India, the traffic rules is the police's beat, so they'll not teach you more. Somebody will go and talk about risk awareness, and every industry talks about HERA, hazard identification risk assessment. But they'll just teach about personal safety, safety of others, but not teach about vulnerable road users. Because that's not my gamut. Practical skills, half of us don't even know how to use road safely, how to cross the road, proper helmet selection. Give an example. How many of you have had licenses, car licenses 2010 ke pehle? Okay. All of us were taught this simple signal. Left side jana ho to left indicator dena hai. Now next time you hit a highway, you'll realize indicators go the wrong way. Because now people have started, the truckers give you an indicator to allow you to pass. You must have observed it, next time observe it. He's not trying to go to the left, but he's telling you can go from the left. Those things go on changing and nobody teaches us.
No, it's not they're changing. It's just that people think that they have to tell. Whereas the guideline is that you have to say what you are going to do. Not tell somebody before and behind you that you can do this.
So, but nobody teaches us. So when somebody
Like the one that said, no, can I overtake? And then the wipers went, no.
So that's...
Said that, I give you a signal. I said, no, I moved my wipers, but that's not what it's for.
So
So a lot of things we tend to make up ourselves.
there's a lot of lack of public awareness, and that's why we are failing. I mean, that's our son Shukanto on the floor. We were invited to KBC. Tapsi Pannu played with us, and he's trying to teach Amitabh Bachchan with the hope that Mr. Bachchan will take it to the film industry and lives will be saved. Nothing that sort of happened. I mean, we just came back not being able to impress Amitabh Bachchan to take it to the film world. And you still have Amitabh Bachchan's film running with CPR like this. It doesn't work that way. This is a nice book if you're really interested in road safety, and individually or as a non-profit if you want to do it, read this. It's a WHO publication. It's a very nice, lucidly written book. It's not about clinical medicine, so you don't have to get embroiled in medical terms. But Advocating for Emergency Care is a very nice book on collaborations on road safety. Just to give you an example why we are not succeeding, all of you I told you there's something good Samaritan law. If you look at this first paragraph, 2021 study found that 62% of individuals still hesitated to help in an accident. There's a decrease. In 2013, 88% used to say, okay, fine, I want to help. So there's been a decrease. The awareness levels in 2018 from 16% has just gone to 23% in 3 years. This is something that saves lives. It protects all of you from being hauled to a police station. कि help क्यों किया? You don't have to go to a police station. The police cannot hold you and say बैठे रहो जब तक admission नहीं होता. The hospital can't hold you. But this awareness is not there. When the law came in, there was a peak. Posters everywhere in every police station, and the government made it mandatory that every hospital has to have it. It's gone off. So a lot of things come up and then they disappear. What are SDGs and why are they important to road safety? The Sustainable Development Goals were born at the United Nations Conference in 2012 in Rio de Janeiro in Brazil. And it set some universal goals on environment, on political and economic challenges facing the world. These SDGs that we call, 17 of them, were preceded by something called the Millennium Development Goals that came in 2000 and was supposed to conclude in 2015. And this was a simple set of goals. They achieved a lot, believe me, but there was no road safety in it. Just to give you an example how goals achieved. So the Millennium Development Goals has this 8 of them. One of them was extreme poverty. More than 1 billion people have been lifted out of poverty. I know, wars, sub-Saharan Africa, everything is ravaged. More people are poor now. But the Millennium Development Goals till 2015 really, the Gaza Strip now is more poor people in the world than anywhere else perhaps. It helped. Child mortality dropped 50%. The number of dropouts of schools dropped by half. And HIV and AIDS infection fell by almost 40%. So Millennium Development Goals really worked. That is what made United Nations sit up and do the global goals, the sustainable goals, sustainable development goals. There's 17 of them. And why are they important to road safety? I'll tell you. But before that, I want to point out something. The 17 goals are all interconnected. So if you look at this, clean water and sanitation, if you take care of clean water and sanitation, what it does is it gives you good health and well-being. If that happens, life on land becomes better. So they're all connected. If look at the 12th, responsible consumption and production, if that happens, you reduce inequalities. If you reduce inequalities, you have zero hunger. If there's zero hunger, there's less poverty. No poverty, but less poverty. They're all interconnected. And if that happens, number 16, there's peace and justice. Because if you're not fighting, the primary need is hunger. And if you're not fighting for hunger, there's peace and justice. If you look at number 7, affordable and clean energy, and if that is achieved, you have sustainable cities and communities. So each of them are linked, the sustainable development goals. And that's the beauty of it. They really are something that you need to learn as individual citizens who are socially sensitized and conscious about things. The great part is that 2 of these goals are on road safety. So number 3 and number 11 are on road safety. SDG target 3.6 tells you half the number of global deaths and injuries from RTA. We need to do that, half it. The 111.2 talks about improving road safety, better transportation, vulnerable road users and everything, and disabled persons. So this really works. There are other road safety development goals. Number 4, quality education. Now you would say, why would quality education have road safety? It is basically ensuring that a child who goes to school and has to return back safe. So that's a part of road safety. It talks of gender equality. In buses, in public transport, women should have space for themselves. Reduce inequalities. Everyone needs to have a right to travel, physically challenged or not. Climate action is a big thing on road safety. What this thing does is, the earlier goals across the world were globally itna deaths half karna hai, ya reduce karna hai. Now they are saying country specific reduce karna hai. You can't say Greenland ko reduce karna because Greenland has 0 accidents. So Greenland 0 se aur kam karna hai, waisa hai. So if India has so many accidents, India needs to reduce half. Some other country reducing it, the global numbers go down and India cannot say we are happy about it. So this is an individual country-wise responsibility given. So what are the fallouts of these SDGs for road safety? After this came the Decade of Action for Road Safety. September 2020, the United Nations General Assembly ruled for that. And it proclaimed the second Decade Action for Road Safety, 2021 to 30, to halve the number of deaths. It was 2020 if you remember, now it's 2030. And the WHO started collaborating with other organizations and came up with 12 voluntary global road safety performance targets, which I'll come to in the next slide. And it made sure every country has its own targets, not a global target. And these are the 12 things that they did. The first four, you really can't do much. It's 5, 6, 7, 8, 9, 10, 11, 12 is what you will do. And I'll come to it later again. But these are the target goals. So what can industries do? That is, I don't know whether there's an industry representative here, but what can industries do? If you're working in an industry, this is what you can take back. Christopher Avery wrote this lovely thing, the responsibility process. So whenever and anywhere something goes wrong, the first thing is denial. बस नहीं हुआ है, गलत नहीं हुआ है, हमने कुछ गलत नहीं किया है. That's our first knee-jerk reaction. I have not done anything wrong. Then you lay blame on somebody. That's the second part. Then you start justifying it, because you have to blame somebody, you need to justify it. Then it hits you and you are ashamed of it. Arey, it was my fault, because 10 people say, it's your fault, not somebody else's. There are two ways to look at responsibility from there on. The book says it. You quit, chalo, meri galti hai, I'm out of the system. Or you are responsible and you say, I'm obliged to change the system, or I'm obliged to change myself. This is how the responsibility process works in our head. And that's what industries and even small entrepreneurs should look at it on road safety. Institutionalize a road safety policy, very important. There should be a corporate road safety policy. As I said, even if you're working somewhere, go back and hammer it back. You just might be able to contribute that. And it has to be a sustainable one, just not, India perhaps is the only country that I've come across which celebrates a road safety week. Road safety should be a 24/7 thing. Thankfully, this government, this time, has made it a month, extended to 2.5 months, I think. But pehle it was a road safety week. Why would it be a week? It's supposed to be a 24/7 thing. How many of you use GPS? All of you? Have you ever heard of something called Google Vaze? Use it. It doesn't just show directions. It tells you which road is susceptible to accidents at what time. Change over from GPS to this. It will tell you इस रास्ते पे कितने accidents हुए हैं जब आप travel कर रहे हो. It's a bit complicated, but it's pretty good once you get used to it. So if you're taking this road from here to taking the old highway or the expressway, you'll know what time frequency of accidents increase. So maybe your transporters and other things will be more careful. You need to ensure safe driving practices for your employers, for your contractors, for everybody. Defensive driving, fatigue and distraction management, alcohol and drug awareness. If you see your driver doing it, Ravi here conducts something called vehicle ergonomics. So for all the men here, when you sit in a car, where is your wallet? In your pocket? Why not in the pocket? Over time, our wallets are going thicker with credit cards and other things. Okay, you sit continuously, travel with a wallet on the right side. Your spine over time starts shifting. It's evidence-based. It starts hurting your spine. The curvature hurts. So these are vehicle ergonomics that Ravi teaches people. You're working on your laptop, please don't keep it loose. An accident and that's a missile. The car turns, you might be saved because you're wearing a seatbelt, but the laptop could hurt you very badly. Go into the eye, hit your head, anything can happen. So that's very important, and I think you take 1.5 hours on this? Yeah. Rest breaks, why are they important? Why do, in the developed countries, even your driver, if you hire a car, will stop the vehicle after 1.5 hours, especially in Europe, and say, I need a break. Why do you think the breaks are necessary? Something else also, ma'am. Great. Engine calms down is very important. Mental thing. There's one more thing. Your body needs rest, and it needs rest the reverse way. If you're stuck in a chair for 2 hours or 1.5 hours, you have a problem of circulation. You need to get out, take 5 minutes walk, come back and sit in the car. It's very important for your calf muscles. Same applies to the driver. It doesn't apply to you as a passenger, it applies to your drivers also. So make sure your driver gets that rest, this 5-minute walk. It's very individual, you need to do that. GPS, dash cams, and please, if you have a car, put a dash cam. It's your biggest insurance against being blamed for a back front collision. कि आपका fault नहीं था, because the dash cam will record that the person was backing. It was not your car that went into it. I've seen so many people finally proving and getting it out of cases because that fellow was reversing. You were stationary. He hit you. But लोग तो बाजू बाजू में देखेंगे आप नहीं लगाया है. And then it becomes a case. Dash cams are very important things to have in your car. Include road safety and employee welfare and CS programs, and get your drivers emergency response training. It's very essential. We had this IS officer, one of, I would say, India's most socially sensitized IS officers, Dr. S.K. Nanda. We lost him last year. He was patron to us for 20 years. And Dr. Nanda used to always say, आप गवर्नमेंट ऑफिशियल्स को फर्स्ट एड में ट्रेन करो या नहीं करो, उनके ड्राइवर्स को तो ट्रेन करो. बिकॉज जिस स्पीड से गाड़ी चलाते हैं, और वो अफसर, एक IAS ऑफिसर का अगर इंजरी होता है, द ड्राइवर नीड्स टू प्रोवाइड फर्स्ट एड, or you lose an IAS officer or an IAPS officer. And that's very important individually also, in industries and everywhere. Your driver needs to know first aid. Foster a culture of safety. As I said, road safety has to have a daily thing. There has to be toolbox talks on road safety, and induction trainings should have road safety part of it. It's very important. In our small organization, we have a couple of rules that are very hilarious. One of them is, if you find somebody without a helmet, one of the staff, and say Ruchita does not wear a helmet, and Ravi clicks a photo of Ruchita and puts it, that day's snacks, which otherwise the foundation would pay for, is now paid for Ruchita. So that's how we have managed to reduce. We haven't been zero on it, but we have managed to reduce. The same with smoking and chewing. Coming back to the silos, it's important because they should not be looked at separately. Enforcement, for example. What according to you is enforcement? I just want to answer. The police enforce करता है ना? What does the police enforce? What is enforcement according to you? Behavior changes. Somebody is driving on the wrong side, somebody without a helmet, somebody. That is what enforcement is. You have a brilliant IPS officer who looks into traffic now, Shafin Hassan. I don't know if you have heard of him. Shafin is on a mission that enforcement is just not about behavioral changes. Enforcement is about engineering also. You will see a lot of places where speed breakers are humps. The Indian Road Congress, the guiding body for engineering to the Ministry of Road Transport, says that a speed breaker has to be this broad, there has to be a curve, it can't go beyond it. And you can't have a speed breaker anywhere and everywhere. कोई भी कहीं speed break, कोई भी कहीं divider तोड़ता है. So that is what Shafin is saying. The enforcement of engineering also is key, because these are engineering faults that lead to accidents also. So enforcement goes through engineering, it travels through education, it travels to emergency care, because you need to enforce emergency care. Ambulance has to have standards, paramedics in ambulance has to have standards. So the silos thing don't work. So most of the E's run through each other. Education, again, there's education of engineering, there's education of enforcement, there's education of emergency care. But we just see education very differently. It doesn't encompass everything. That needs to change. I talked about the global targets. These are the 12 global targets, but they have stages. The middle thing is stages. There are actions, plans and implementation that you need to look at. There are outcomes that you need to measure, and there are improved road safety, the impacts that you need to see. Any intervention that you do in your house, in your school, in your college, going back, or as an employee, as an employer, you need to look at impacts that are happening. Because most of our interventions are perception based, which is very wrong. हमें लगता है ये होना चाहिए, कर लेते हैं. Nobody does a study. India's interventions don't have a follow-up study, and that is a very limiting factor. So what are the impacts you look at when you implement something? Reduction in crashes and injuries amongst employees, improved compliance with government transport, enhanced reputation, and then tangible contribution to the sustainable development goals. Please understand, the SDGs are universal. You want me to go back to the slide, sir? No. Done? Okay. The SDGs, please remember, are universal, holistic, and people centric. They are not government centric. And so is road safety. Road safety is not government centric, it has to be people centric. I'm sure Gauri will talk a lot on it, but it has to be people centric. Having said that, coming back to this 12, 5, 6, 7, 8, 9, 10, 11, 12 are your individual voluntary responsibilities also. It is not about government or institutional, corporate or otherwise responsibility. Government, your own responsibilities. Timely emergency care, having professional drivers, distracted driving, mobile phones, influence, everything. That brings me to Ahmedabad. Every 2 years, in February, we are at AMA doing India's biggest national conference on road safety. We will be back here in 24th of February to 26th of February. And I always say, and it's a very important statement that you always make, that there doesn't exist a single person in India who's not had to deal with the trauma, physical or emotional, of losing a family member, a co-worker, a friend or somebody. So if you want to do something for road safety, you could be at the conference here. The registration documents have been handed over to you. And what this conference brings is, unlike other conferences, we also have workshops, hands-on or tabletop. So if you have an NGO or you want to start an NGO or you don't know how to go about it, for individuals and NGOs, there's a capacity building workshop. कि NGO कैसे शुरू करना है, क्या कर सकते हो. You can do and enforce. You can't stand at a crossing and say traffic control करता हूँ, but you can do other things. So you need to understand these workshops. If you ever want to start, or a friend, a family member, a colleague wants to start an NGO on road safety, be here at the conference to learn right from how to raise funds, what you can do, what are the legal obligations that you have. There's a workshop for trauma. We train people in primary trauma care what you can do. This is beyond a bit of first aid. Again, very lucid, not very technical, so you can be part of it. And there's a defensive driving workshop to sensitize you. Gauri is a big advocate of defensive driving, and we could have sessions on this. We'll have 4 sessions on defensive driving. You could have friends and others coming in, but you need to register for the conference to be here. You just can't walk into the workshop, right, Sushmita? Okay. On the 26th, we have a workshop that if you are an insurance person or no insurance people, they could be part of it, because it's a accident investigation for road traffic accidents. Please understand the reason that most of the times your insurance claims in an accident don't really go in your favor is because evidence is destroyed. Accident हुआ, traffic police का पहला काम है गाड़ी हटा लो, because he wants to keep the road clean and clear. If you go through this workshop, and a gentleman, I don't know if you've heard of him, Dr. Keshav Kumar, he's a doctor now, PhD. So Dr. Keshav Kumar retired as DG Police, Government of Gujarat, was ACB's head here, and he has started to train people in accident investigations, how to preserve evidence before it is destroyed. We all have a cell phone, so it will give you tire marks, it will give you crash marks, lines, evo. Kaise lena is the technique that he goes on teaching. So that's a workshop that you can talk to your friends to be part of it. This is the conference. This is already frozen. It's a year, nearly 8 months, but we have policy frameworks. We are building public-private partnerships. We have people coming from Geneva, the International Road Federation, involvement of non-enforcement stakeholders for forensic investigation. We have ORDA coming and talking on the road designs and maintenance of road safety. We have drivers, a champion of drivers, Ramesh Kumar. If you Google him, you'll realize he feels, and he really maintains it, that let's not blame drivers. Let's take them on board to improve because they also die. It's not only truck drivers don't kill people, they also die. There's trying to put public health issues for road safety. So there's Dr. Shyam Pingle, who was with the Indian Institute of Public Health, Gandhinagar. So a lot of stakeholders are coming in to be here. We have panels on regulations of app-based taxi services, food delivery, and aggregators and road safety. So we're getting Swiggy and Ola and others to be part of it. Enforcement of helmets, as I said, this is a nice case study of Guwahati that we're going to have. Child safety on Indian roads, nobody talks about it, unfortunately. But believe me, the number of kids who die are huge, it hurts you. Emergency care on highways, we're talking about it. But if you look at the last part of this slide, and if you have done any innovation, if you think you have done a project which is worth listening, there are 15 slots or 10 slots available for you or your friends who have worked on road safety to come and present. There would be around 300 people listening to you, and maybe somebody, and there would be funders also. So somebody just could pick up an idea if there is available. Thank you. Any questions? But I suppose Gauri could take more questions than me. She's a local lady, knows more of Ahmedabad than I do.
So I got a joke this afternoon,
I'll take mine.
and it's very relevant for this evening. I was driving with my 3 young children one warm summer evening when a woman in the convertible ahead of us stood up and waved. She was stark naked. As I was reeling from the shock, I heard my 5-year-old shout from the back seat, "Mom, that lady isn't wearing a seat belt." We need to get to this point, right? Only when we reach this point will we have achieved what we've been doing for the last 20 years and probably making a very minor dent. It's quite frustrating actually, yeah, to watch young people you've known die in accidents. Sometimes they are wearing helmets, sometimes a truck knocks them over because of visibility issues. So there are so many reasons, but mainly it is the human fault. Today, cars are far more advanced in safety than we can imagine. Probably self-driving vehicles would be a boon for us, yeah? And there is somebody, I think in Chennai now, working on models for Indian roads. You know, what does a self-driving car do if a scooter crosses in the front? This is our behavior. So the main problem in India, according to me, is human behavior. And unless we change the next generation, there is no way we can be considered an developed country. Yeah? Because we all need to move. Remember the days, some of you are older than me probably, that we used to go in bullock carts and horse carriages and things like that. Did you ever hear of a purposeful accident between 2 animals? You did? Interesting. No, I'm talking that if you're in a horse carriage and there's a horse carriage coming, those 2 horses will not purposely collide, right? Because they use their brains and say, okay, if we 2 hit each other, it's going to damage us. The difference today is that we don't have the horse or the ox thinking for us. Today, we are sitting behind the wheel thinking that we are all powerful and putting our feet down, accelerating, and joyu jase, thai jase, I'm invincible. So this is the attitude which causes it. In every other country, we are also aware of the fact that during the teenage years, you have raging hormones. So to dilute that speeding on the highways and the roads, they create areas where children can safely go and speed, jump, ride their bikes. It's called, those are dirt tracks, yeah? And then they will come back to the road and drive in discipline. What is happening on our streets? They are letting their hormones rage freely on the road at the cost of everybody else. And making reels of it. Yeah? Correct. So this is part of also the gaming problem, where you can die and get up again and ride again, right? You don't die. Death is not a reality. And when you show children and you ask them and to tell them that what do you want to be when you grow up, mostly they know from home. Actors, actresses, doctor, engineer, all this, right? So what do you need to do to reach that goal? Somebody has to take you to school, pay your fees, etc. Who does that? Correct? And now you tell them, what if your parent doesn't come home? Children see their whole life shatter. And that is why I have always targeted little children to become ambassadors for road safety. Because they will tell their father, I am not riding with you to school if you don't put on the helmet or put on the seatbelt. And there is a very famous journalist who told me that it's just this kid of mine, because if the cop stopped me, I would say, Jo pelai nathi peryu, Jo pelai nathi kari. But my son always sat next to me and said, Dad, seatbelt. No using the phone while driving. And then it became a habit. So it helps. Because in front of your child, you don't want to be wrong. Right? So it's very important that we address road safety at a very, very young age. Make it a habit. A habit. Engineering is a very huge problem in India because we are not doing it right. I know also the traffic police is constantly at war. You want us to solve this, but if you don't solve that, we can't do it. Yeah.
The government should also do engineering like multi-layer bridges. So that there are more than
I will tell you something, bridges do not solve traffic.
what bridges? No,
Traffic is solved by good driving.
not like that. See, it's a traffic jam problem. People have to go to the office in time. Otherwise, the other will cut. Suppose I am doing it, I have to reach at 8 o'clock. So I have to drive roughly. I drive on the footpath. Everybody, 80-70% people drive on the footpath. So because the government is not providing infrastructure for the last 25 years.
First of all, sir, the government has a task to provide infrastructure based on the amount of population. Yeah? The amount of vehicles is our choice.
Similarly, before 30 years, the Ahmedabad population was only 25 years.
Correct.
So now
Correct.
it is 1.25 years.
Correct.
Even though
So
they-
their task is to improve.
They don't even understand. They don't.
No, so the task of the government here is to improve and increase public transport. Private vehicles is not their problem.
No, every day, more than 1,500 vehicles are sold. So if you count,
So that has to be curbed.
you cannot stop public buying the.
Singapore does that.
You can't stop the people buying cars.
Singapore does that.
So Singapore is a different. It is India.
So this is when we stop saying this is India, is when we will be able to make the change.
Singapore have multi-layer bridges. They have planned 100 years before. In America,
No, not 100 years before.
America also, they were, yeah, from 1970.
No,
They have multi-layer bridges. In America,
we have to accept,
not a single multi-layer.
we have to accept our mistakes. What Subroto said first, we have to accept our mistakes first.
No, it's a mistake that we have a democracy. It's a obvious parameter.
Yes, sir.
Bureaucrats.
I would like to throw some light on this also.
Yeah.
Gadkari, only Gadkari is working
If
nicely.
you allow me to speak. First of all, I'm someone who can speak on this because 18 years now I have driven cars in the UAE, which is one of the strictest,
Correct.
license procuring
Correct. Methods.
You don't believe that they are so much worried about the human life and they give so much importance. First, it starts with the driving license.
Correct.
In UAE, in Dubai, you have to get a driving license. 3 cops will sit with you in the car. There'll be a senior cop who will sit next to you, and there'll be 2 sitting beside. One is going to see the front mirror how you are watching, and other are going to see the side mirror. And the second thing, they give a lot of importance to the lane driving, radar. The roads are so good. There is a proper lanes painted. The workmanship is so good. See, all these things are missing in our country.
Who does all that in the UAE?
You know,
Indians?
no.
Most of the engineers are Indians?
No, that's not the thing. I'm trying to say that the issue in our country is there is a lot of issue with the implementation, workmanship. The
But
roads
who
are not
does that?
properly.
It's people from amongst us, right?
No, I get
Companies that are from here, labor that is
it.
from
Because
here.
people know that they'll get away with it, because there is no strict laws in
So
our country.
who is allowing it to get away? You and I.
Ma'am, that is okay what you are trying to say, but eventually there has to be a strict law enforcement. And if these people who are breaking signals and jumping, if they are being given strict penalties or some form of a jail for a week or something, there will be lesser number of this
So
traffic.
as parents, as adults, we have to teach our next generation the right way.
Yes.
We have to make them feel responsible
So
as
we'll
well.
have to do something
and
like-
we have to be responsible in the way we behave.
And there should be also traffic education right from the schools, from the very early
Why
stage.
school? Why not parent?
No, that is there, but even
Why
in the
not
schools
parent?
also. Like we always praise Japan, that they don't litter. They have a lot of civic sense, hygiene, because they've been taught those things in school. So you learn all the things.
No,
on
you
the
start
school
at home. You always start
No,
at home.
I get you. Home is also fine, but then school also it should be a subject.
I absolutely agree with Gauri and the lady at the back. The issue of road rage and everything breaking rules starts at home. I have seen it
No,
myself.
I agree. I also agree with
So
that.
let me finish. I have seen it myself, and if anybody breaks rules, whom do small kids look at role models? Not teachers,
Parents.
parents. First role models are parents.
Yes. Agreed.
As we grow, fine, our role models change, and we see our role models breaking rules.
But as a later on as a
अरे
reinforcement.
सर जी वो किसने उस दिन कहा ना कि बचपन से हमें सिखाया जाता है, घर में से सिखाया जाता है रूल तोड़ो.
हाँ सर, सही बात है.
हम पैदा ही होते हैं रूल तोड़ के.
सही बात.
दैट इज व्हाट इट इज. वो घर से सीखते हैं हम.
ये सबसे पहले तो बच्चा पेरेंट्स से ही सीखता
तो
है.
फिर दैट इज द प्रॉब्लम. इंफ्रास्ट्रक्चर एंड अदर थिंग्स आर सेकेंडरी. आई विल गिव यू एन एग्जांपल. मणिनगर रेलवे क्रॉसिंग, वी वर स्टक दैट डे. दिस इज ह्यूमन बिहेवियर एंड नथिंग एल्स. It has broad roads at the level crossing. ठीक है? You were supposed to be on one side, let the other side pass. But जैसे ही वो बंद होता है railway crossing, both the sides are blocked on both sides of the railway track. क्यों? Why can't you stand in line? Because we think हम पहले से निकल जाए. They don't realize they block it more. There's more fuel wastage. There's more pollution. Everything. But we'll have to beat. India perhaps is the only country where we are ashamed to stand in line. Behind each other.
Yes.
एक बुकिंग काउंटर पे जाइए आप खड़े हो, उसके बाजू में आकर दूसरा कोई खड़े रहेगा, पीछे नहीं खड़े रहेगा कोई. एयरपोर्ट में चेक इन के लिए सिक्योरिटी चेक कीजिए, कोई आपको धक्का मारेगा, वो येलो लाइन तो कोई फॉलो ही नहीं करता. व्हाट एनफोर्समेंट विल यू डू? सिक्योरिटी वाला बोलता रहता है आप येलो लाइन के पीछे आ जाओ.
हार्ड शोल्डर से लोग फोटो खींचते रहते हैं सर.
क्या कर दोगे आप? इट इज नॉट अबाउट इंफ्रास्ट्रक्चर, इट्स अबाउट आवर वे दैट वी लुक एट इट. रोड सेफ्टी इज नॉट अ प्रायोरिटी. दैट इज द प्रॉब्लम इन इंडिया. बिकॉज वी आर टू मेनी. क्या फर्क पड़ता है? मणिपुर में 2 जन, दिल्ली में 3 जन, आज वासद में 1 जन, वलसाड़ में 1 जन. इट डजंट रिफ्लेक्ट.
It only matters
But-
if it's your relative.
That also doesn't matter. I've come across this friend of ours who lost a brother in Sabarimala. If you remember the stampede, what was his response when we went to his house to condole? He died at the right place at the right time, pious jagah pe. That's how we justify, because as a nation, irrespective of our religion, we are fatalistic. The first thing is, it will not happen to me. That's our first attitude. I'll smoke 10 cigarettes a day. Gauri just smokes 1 cigarette, but Gauri को कैंसर हो सकता है, मुझे नहीं हो सकता. That is our attitude. So first is, it won't happen to me. The second thing is, if it happens, it's karma. Irrespective of our religion.
बहुत इजीली लिंक कर देते हैं.
Very easily. We justify death. We justify
So
wrong.
take yesterday's incident, on a weekday, working day, 4 lakh people turned up in a stadium capacity of 35,000, in Bangalore.
We don't behave. That's why I said cars are safer, but the idiots sitting behind the steering wheel, if they don't upgrade themselves, the problem is not going to go away.
Police had told the government ministers that this is not going to Sunday का काम करो. So it is like incident Bangalore में हुआ. It was clearly told by the police. But they did not listen.
Yes, sir. I totally agree. Myself, Dr. Jayashree Jani. I am a principal of a school, Sri Narayan Guru, in a satellite area. And here, in the same way, we have started the drive, as you said correctly. that our children are the ambassadors for the road safety. So we run a drive and we made not only the hoardings for the same, but we told that कि आप अपनी मम्मी या पापा से बोलो जब आपको ड्रॉप करने आएंगे तो रॉन्ग साइड से ना आए. आप मम्मी पापा को बोलो कि सेफ्टी रूल्स फॉलो करें, हेलमेट पहने, आपको भी पहनाए. तो नाउ इफ द चिल्ड्रन आर सेइंग देन द पेरेंट्स आर रियली लिसनिंग टू देम कि उनको पता है मैं गलत कर रहा हूँ. लेकिन हमें बचपन से ऐसे ही बताया गया नियम क्यों है? तोड़ने के लिए. रूल्स आर मेड टू बी ब्रोकन. व्हाई? द रूल्स आर फॉर द डिसिप्लिन एंड हमारे घर पे ही शुरू हो जाता है ये चाल.
So if it
तो ये
was
नहीं
our
होना चाहिए.
birthright to be on the road, if
Right.
it's our birthright, we wouldn't need a license. Right? If you want to go to the US, you need a visa. And then you stand in the queue and you follow everything. So why not for your driving license? Why do you get a agent and he will manage everything? This is where we seriously do not take things seriously. I remember doing a Chintan Shabir with the RTO and they said મહેસાણાથી માણસ આવે આખો દિવસ એનું કામ છોડીને તો એને થોડો ખાલી હાથે પાછા મોકલાવે. I have to issue a license to him. I said, how do you sleep in the night? That means that every accident that takes place, you are responsible for it because you issued a license to a person who is not capable of driving correctly. Correct? So, it is unless the drive happens from within us, within the communities, safety at all levels. I am now discovering also with this foot that it's not just about the road safety, it's about how I get into a building, how I get out of a building, how I can access a lot of things. Yeah? And we don't care. Human life doesn't matter. Yes, please.
નેશનલ હાઈવે ઓથોરિટીને એવા ગાઈડલાઇન્સ છે કે ભાઈ નેશનલ હાઈવે ઉપર બમ્પ્સ ના હોવા જોઈએ, પણ ઓબ્ઝર્વ કર્યું છે કે જ્યાં જ્યાં બી થોડોક બી લિટલ કન્જેસ્ટેડ એરિયા હોય તો ત્યાં બમ્પ બનાવી દેવામાં આવે છે હાઈવે ઉપર પણ. બીજું કે જે બમ્પની હાઇટ અને વિડ્થના જે સ્ટાન્ડર્ડ્સ છે તો કોઈ જગ્યાએ મેન્ટેન થતા નથી. ત્રીજું કે મેં અમદાવાદ સિટીમાં એક વખત આરટીઆઈ બી કરી હતી તો કોર્પોરેશનવાળા દે આર ટોટલી ડિપેન્ડન્ટ ઓન ટ્રાફિક પોલીસ. ટ્રાફિક પોલીસ જ્યાં કહે ત્યાં એ લોકો બમ્પ બનાવે છે. પછી એએમસીનો એન્જિનિયર એનું મગજ નહીં દોડાવે, એ બમ્પ બનાવશે ને અને ચોમાસામાં વરસાદ આવશે ને એટલે બમ્પના લીધે જ પાણી ભરાઈ જશે. એટલે આપણને એમ થાય કે આ એન્જિનિયરો છે કે પછી એના કરતાં પહેલાં લેબર હોય ને એ બી વધારે બુદ્ધિવાળા હોય.
Unfortunately, it is a very political thing, a bump.
Yes.
Okay? So, the only force our corporation has to manage traffic is put a bump.
Bump, yeah.
Not even ensure that your traffic signals are working 24/7.
Yes.
Right? So this is one of the main things. And correct.
Yes.
But so today somebody will say, I am MLA and there is traffic jam happening outside my house, you put a bump.
Bump, yeah.
They will run and put a bump. Overnight, you will wake up next morning. Yeah. Yeah. So they are now thinking of bringing classical Indian music to honking. But the idea is that you should not have to honk at all, right? Even sa, sa, pa, pa is a noise.
In Bombay, I have seen that some signals are photosensitive. There is no traffic, or the signal, the green light will automatically. There is no.
So
that is in Singapore also.
There is a lot of things, technology being introduced.
In Ahmedabad, 90 seconds is 90 seconds. Even if nobody is going 90 seconds,
Yeah.
red light.
Correct.
Bombay, it becomes 20 seconds also.
Correct. But Bombay is also, in some areas, punishing people for honking. If you honk, the signal will go on and on and
yes,
on
yeah,
till you
yeah.
realize that you have to stop honking.
And the
So-
second thing is, ma'am, that બમ્પ બનાવવાથી અકસ્માતો અટક્યા એ વસ્તુ અલગ છે, પણ બમ્પથી અકસ્માત કેટલા થયા એનો કોઈ ડેટા કે કોઈ રેકોર્ડ આપણને મળતો નથી.
I think there is data with the. Yesterday I saw one at Nehru Circle. right in the middle, they had put a block, and in the roundabout. So there are a lot of things, but if you are an alert citizen, you can always call the police and say, there is a problem here on this road, there is a gutter open, please have it addressed, and they will take action. Yeah, so we have a very effective police service here. Huh. And we have the only problem, like he said, is the silos do not connect very often. And we have NGOs, etc., who have taken it upon themselves to bring them together.
Yeah.
I have been part of that many times at AMA. We have called the RTO head, the traffic head, the corporation head, and engineering people to sit on a panel, and then let the public ask them that how are you going to solve this? How are you going to solve this? Unless we make this happen constantly, show that we are interested in solutions, it's not going to happen. So we have to be alert. There is also a program for 8th standard students.
We have to stop blaming the government.
Correct. Be the change.
Okay, just a point. We have to go back to Baroda and we don't drive after 10:30. So if you'll excuse us, we need to reach at 10:30.
So on behalf of AMA, I would like to felicitate. Yeah. Thank you so much, Subroto.